Hi everyone. So Jill and I had colorectal cancer. It is a heterogeneous disorder, which means it arises from several other disorders. It's present in both men and women. It mainly affects the bowels, but symptoms of changes in the bowel and stomach function could also arise. It begins with the formation of polyps, which is abnormal tissue growth. Benign or malignant tumors arise from this. 90% of the cases are sporadic, while 10% of the cases are hereditary, and it occurs in epithelial cells in the intestine. That's a picture of polyps. Drugs used for chemotherapy include 5-fluorouracil, which is a prodrug that inhibits thymidylate synthase. It's an enzyme that's involved in synthesizing to form thymine, which is a nucleic acid in DNA. This occurs after intracellular conversion of the drug to activate metabolites. It ultimately impairs synthesis during replication or S phase. It does this by falsely incorporating metabolites into RNA and DNA, which interferes with protein production. Patients who use the drug generally respond to it, meaning they benefit from it. It stabilizes the cancer and increases their quality of life, along with duration of life. Side effects include nausea and vomiting, diarrhea, and myelosuppression. This is a decrease in bone marrow activity. It results in lower red and white blood cells along with platelets. Besides nausea and vomiting, the other side effects arise from the drug's effect on rapidly dividing cells.
Capecitabine is a drug that is used for chemotherapy. It is administered orally. It is a tumor-activated drug that generates 5-fluorouracil within the tumor. After it's taken orally, it passes through the intestinal membrane as an intact molecule very fast and extensively. Once absorbed, it is transformed into 5-DFCR, which is 5-deoxy-5-fluorocytidine, by hepatic carboxylesterase. It is then transformed into 5-DFUR, which is doxyfluoridine, by the pyrimidine nucleoside phosphorylase, which is primarily located in the liver and tumor tissues. 5-DFUR is then converted into 5-fluorouracil by TP, which is thymidine phosphorylase, a tumor-associated angiogenic factor. TP is present in tumors in higher concentrations than in healthy tissues. The fact that it's present in tumors in higher concentrations reduces the exposure of healthy tissues to 5-fluorouracil. The tumor cells metabolize 5-fluorouracil to 5-fluoro-2-deoxyuridine monophosphate, which is FDUMP, and 5-fluoridine triphosphate, FUTP. They cause cell injury by two different mechanisms. The first mechanism is that FDUMP binds to thymidylate synthase to form a covalently bound ternary complex. This binding inhibits the formation of thymidylate from 2-deoxyuridylate. Thymidylate is a necessary precursor of thymidine triphosphate, which is essential for the synthesis of DNA. A deficiency of that compound can inhibit cell division. The second mechanism of cell injury is that nuclear transcriptional enzymes can mistakenly incorporate 5-fluoridine 5-triphosphate, FUTP, in place of uridine triphosphate, UTP, during the synthesis of RNA. That metabolic error can interfere with RNA processing and protein synthesis. Some symptoms that come along with this drug are stomach pain, constipation, loss of appetite, taste change, increased thirst, tiredness or weakness, dizziness, hair loss, and skin rash.
Irinotecan is another drug used for chemotherapy. It is a topoisomerase inhibitor. It is an enzyme that regulates winding and unwinding in DNA. It blocks cell division and it induces single-strand DNA breaks. Benefits have been shown in metastatic colorectal cancer. Anti-tumor activity has been shown when used for metastatic colorectal cancer. Side effects include early cholinergic syndrome. This is a massive discharge of the parasympathetic nervous system. It causes bradycardia, which is slow heartbeat. Other side effects include diarrhea, hypotension, which is low blood pressure, and abdominal cramps. The use of atropine along with irinotecan helps keep your heart at a stable rate. Delayed side effects include diarrhea, neutropenia, which is low white blood cell count, vomiting, and alopecia, which is sudden hair loss. The use of irinotecan increases toxicity. The use of irinotecan and 5-fluorouracil is more effective than using just one or the other drugs alone.
Oxaliplatin is a third-generation platinum analog. It is a clear liquid that can be administered intravenously. It can be put into the vein each treatment, or it can be put through a central line. The mechanism of cell injury is that it forms both inter- and intrastrand crosslinks in DNA. The cross-linkage prevents replication and transcription. Some common side effects of oxaliplatin is increased risk of getting an infection. This is due to a drop in white blood cells. Tiredness and breathlessness due to a drop in red blood cells. Bruising more easily due to a drop in platelets. Tiredness, numbness or tingling in the fingers and toes, diarrhea, and taste changes. Some uncommon side effects are sore mouth, mood changes, increased risk of blood clots in the lungs, and difficulty swallowing. Some rare side effects are kidney damage, hair loss, and loss of fertility.
Other forms of treatment include polypectomies, colectomy, ileorectal anastomosis. These are all forms of surgery which remove parts of the intestine or polyps.